Hello. If you're like many other patients during an appointment with your healthcare professional, or HCP, remembering what was said and following through on medical advice can be very confusing. October is Health Literacy Month, so there's no better time to adopt a healthy habit for more effective communications with your doctor, pharmacist, or other HCP to ensure your safety in using medications or following medical advice. My name is Heather Mitchell, and I've been helping patients to follow health instructions correctly and to safely take their medications for over 20 years. I'd like to share a simple practice with you that can help you get more out of your appointment and feel more confident about following through with instructions from your healthcare professional. But first, I have a question for you. A number of studies have looked at how much information patients forget from the conversations with their doctors, and more specifically, the medical instructions about medications they are prescribed or guidance on what to do. So how much medical information do patients actually forget immediately after their medical appointments? I'll give you a couple seconds to think about it, but the answer is alarming. Imagine that this green pie represents all of the medical information given by the doctor to the patient. On average, after their appointment, a patient will forget between 40% and 80% of that medical advice. That's almost half to the vast majority of information. When we want to do what is right for our health, getting instructions wrong that often is definitely a cause for concern, as it's been shown to frequently lead to taking medications improperly, hospitalizations, and potentially serious consequences. There are any number of factors that might affect how much a patient remembers or forgets during an appointment. They could include your current health and how you're feeling that day, the nature of the information shared, such as receiving a serious diagnosis, which could stir up all sorts of thoughts and emotions that block out any additional information that follows. If you receive a lot of information, it can be very challenging to remember it all. And the way in which that information or guidance is shared makes a difference. If there are a lot of technical terms thrown in that you don't understand, then it can be hard to remember what was said or what was meant. The surroundings and environment also makes a difference. For example, it would be much harder to concentrate if you're receiving instructions in a noisy emergency room compared to a quiet doctor's office. And also important is how involved you are as a patient. Studies have shown that patients who are more engaged or interactive when it comes to their health generally fare better. It's for this very reason that I'd like to share a simple but healthy habit to help you be more involved in your own healthcare. It's all about 3 questions you can ask yourself. Write these 3 questions down and bring them to your medical appointments or health consultations. If you are confident that you know and understand the answers to these questions, you will be in a much better position to remember and follow your HCP's instructions correctly. The first question to ask is, what should I do? As simple and straightforward as this question may seem, it's easy to gloss over or forget important details. For example, if you have been diagnosed with a condition and given a prescription, it's important to understand the name of your condition, any prescriptions that you would have to take, and what it is that you'll need to do to manage it, including other instructions such as changes you would have to make to your lifestyle. You'll also want to know why it is important for you to follow the instructions on what you should be doing. Understanding the significance of the valuable medical guidance you are receiving can help you to remember the instructions and also motivate you to continue following through with what you have been prescribed. Put in another way, what might happen if you do not follow through with this medical advice? There may be short-term and long-term consequences that are critical for you to know. The last question has to do with going deeper into detail on what you should do. Understanding the specifics of taking your medication properly is an excellent example. Let's say you are instructed to take 1 pill twice a day. There are many ways that you could follow that instruction, but not all of them are correct. For example, you might take 1 pill at breakfast and the other at lunch. However, perhaps you were supposed to take those pills 12 hours apart and on an empty stomach, meaning without food. Perhaps that medication could not be taken with grapefruit juice, otherwise, it would affect how much medication your body was supposed to absorb. Details are important and can potentially affect how well your situation turns out. If you are unsure of any of the answers to these 3 questions, what to do or how to follow your HCP's instructions when you get home, be sure to tell them while you're still in the office. They are there to help you. In the next segment, we'll go over some suggestions for what you can say and do while with your HCP to feel even more confident about the instructions you've received. Be sure to write these 3 questions on a small piece of paper and keep it with your Medicare card as a reminder of what you should know. And you'll be 3 steps closer to being informed and prepared to manage your health more effectively. Thanks for listening, and be well.